so I get not only to have notes, but I get to put them right up in front of me, so I won't have to put my glasses on. And I've been eligible for Medicare for 13 years, so I'm in really good shape as a result of that. I'm a veteran, and some of the past I might share with you. I was on the national campaign staff in 1964 of Johnson Humphrey, for Hubert Humphrey, and Lady Bird Johnson, and we got them elected, and they passed Medicare the next year in '65 when I ran for the Virginia State Legislature and was in there in '66 and '70, and for some reason or another, and it's probably because voters and citizens find taxes and health matters to be more complicated, I found out, being in the legislature, than anything else. You can't sum it up with one or two spin words or buzzwords, that for some reason or another, the other people in my delegation didn't want to do health. They wanted to do roads and education, so I got to do health, and that's exactly what I wanted to do. In those years, we had the Community Health Center legislation introduced by Kennedy that came down to the states, and now we have our community health centers here in Colorado Springs. And I look back on these 44 years. I have a few things I saved in my scrapbook, and one of them was an article from 1965. Says Medicare cut. You know, what else is new? This is not 65. This is 70. This is Nixon 73, but that's only 8 years after the introduction. Almost immediately, the cuts were going to come in Medicare, and that's a word that I've always associated with Medicare. You just about get it, and they start cutting it, and it's been a battle for 44 years to restore those cuts each time they were taken away. What they were going to cut in '73 was public health service, emergency health service, research into better ways to deliver health care. $1 billion was trimmed for 23 million people who were getting Medicare at that time. And then I pick up yesterday's paper. Bipartisan senators proposed to cut $35 billion out of Medicare to meet increased health care spending costs, which is just the wrong way to do that. Medicare should never be cut. It was the first giant step for humankind to create adequate health care for all Americans in the future, which I hope would include dental and my ear care as well for seniors, which it doesn't now. Let's take an example of present practices also in the paper today. That one was yesterday. This one is, we can't afford not to reform healthcare. Did anybody read this in the Gazette today? And the person is Michelle Duncan, and she's a woman, of course, she's described as passionate, and a passionate advocate for health care reform. That's all I find out about her. Well, I'm glad she's passionate, as I am, about health care, but we don't know, I don't know, anybody know this person? I mean, here's a person to find out about, because this was really good stuff in here. One thing as a veteran that really concerned me, in that article it says that less expensive pharmaceutical drugs from Canada are banned by Congress from pressure of lobbyists claiming that they, quote, don't meet our standard of quality. But at the same time, our government buys these drugs for use in VA hospitals to save money. I receive health care from the Veterans Administration, and I tell you it's very good health care, but as a veteran, I find it not acceptable at all for our government to give veterans less health care and the rest of the U.S. not adequate health care that they get in Canada and elsewhere. Cutting Medicare or providing poor quality health care is not the way to bring adequate health care to all Americans. The way to do it is to give all American health care that is equal to what Congress itself gets. And the best way to do that is through a single payer program that truly would celebrate 44 years of the only true health care America has seen in Medicare and Medicaid. And this is after recovering each time Medicare is cut by Congress, that we spend more money killing people in war than saving people by a decent law. Happy birthday, Medicare.